Okay, I'm so glad I got this video stuff figured out. It just takes a long time because it takes forever for these to load. But anyway, half the battle is knowing how to do it. I think I finally got it. This is a slide basically for you guys to practice the presumptive, probable, or positive signs of pregnancy. And I'm going to be pausing and letting you write down your answers or whatever so you can get some application practice of information that we covered in our first set of slides. So, nausea and vomiting. Are those presumptive, probable, or possible signs of pregnancy? Yes, they are presumptive because patient reports it, right? We can't see it unless she pukes in front of us. But the patient reports us and tells us about it, but something else can cause nausea and vomiting, many things. Influenza, food poisoning, medication reactions, and of course, too much Friday night fun, which is what I was having last night. I was not throwing up, but man, I was getting a headache. It was very frustrating. So anyway, my Friday night was not fun. But anyway, our wonderful, responsible nursing students were home studying Friday night too. So I'm pretty sure that you guys were right there with me. But yeah. Goodall's sign. First of all, what is Goodall's sign? Do you remember? Is it the bluish color of the cervix? Is it the softening of the cervix? Or is it the first fetal movements? I should let you look it up. Yeah, look it up. Nah, it's the softening. Softening of the cervix is a probable sign because it's not presumptive because the patient can't see it, right? And it's not positive because other things can cause that softening. And there we go. Not presumptive, patient can't see or feel it. Not positive because pelvic congestion can also cause that softening. So it's not positive. Quickening, what is that? The word itself kind of gives it away. Quick, 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 quick. What starts to quicken down there? The first fetal movements, of course. Is it a presumptive, probable, or possible sign of pregnancy? What do you think? It's presumptive. You might want to think it's probable, but remember, the patient reports that to us in early pregnancy especially. And what else can cause that little type of feeling down there if it's not a fetus? And the hint is guys too can get this and do often. We all do often. Could be gas. So presumptive, especially in the very early parts of pregnancy, is, quickening is a presumptive sign. Fetal heart sounds. What is the normal range of a fetal heart rate? This is an extra credit question. So, normal range, 110 to 160. Did you get it right? Might want to remember that. And they are a positive sign because what else can cause that sound in there? You put a Doppler on abdomen and you're hearing boom, 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 boom. There's not a whole lot more that can cause that other than a fetus. What makes it be a positive sign and not presumptive or probable? Well, the provider will hear it. So it's a provider that will hear it or the nurse. And it's a heart rate that's 110 to 160 is not likely to be anything else. Chadwick sign. Again, what is Chadwick sign? Do you remember that from the antepartum slides? Oh, it's blue for a reason, guys. Chadwick sign is blue for a reason. And it's a probable sign. It's that bluish color, and it's probable because patient can't report it. She can't see it. We can, and other things can cause it. Cervical infection or hormonal imbalance are other potential causes. Amenorrhea. Is that presumptive, probable, or possible? I think you'll get that one. Presumptive, because, oops, I thought the answer was going to be here. It's presumptive because the patient reports it, and lots of things can cause us to miss our periods. Ballottement. Do you remember what ballottement was or is? I showed you, I think I drew a balloon with the whoop flopping up. It's that movement of the baby up when a provider puts her finger in and pushes on the cervix. It goes whoop, whoop. So that's ballottement. Is that a presumptive? No, because the patient can't see it or do it. Is it probable? Maybe. Or is it positive? So it's probable because, okay, that's what it is. It's the passive fetal movement in response to tapping of the lower portion of the uterus or cervix. So what is it really? And we've already talked about that. When an examiner does the internal vaginal exam, pushes up on whatever's inside the cervix. To do this, there's obviously has to be something in the uterus, and it's usually a fetus, but tumors and cervical polyps can also be there, and yes, be movable. So now you know the correct answer is, ta-da, probable. So work through it, you'll get it. Take it a step at a time. A couple more quickies just to practice. And you can ask questions, but it's going to be to your roommate. If you see the baby, if you visualization of fetus by ultrasound. Okay, if you have trouble with this one, we'll talk after class next week. It's positive. You see the baby. Laboratory results indicating pregnancy. This might be tricky, so think before you answer. One would think a positive pregnancy test means you're pregnant, but is it? It's probable. It's not a positive because other things can cause a change in our hormone levels. Palpable fetal outline felt by the examiner. So you're there, you're feeling the baby, you're feeling what you think is a fetus. Is that a presumptive? We know that's a no. How about probable or positive? It's probable because probably that's what's in there. It's probably not a tumor, but we don't know just by our hands. Breast enlargement and tenderness, presumptive, probable, or possible? I mean, positive. What is it? Presumptive. She's probably pregnant. Or not probably. One can presume she's pregnant because not a whole lot of things do cause breast tenderness, but some things can. So it's not a positive or even probable. Fetal movements felt by the examiner, felt by the nurse after 16 weeks. So we've got our hands on our abdomen. We feel the baby kicking or the fetus kicking. Is that presumptive? You know that's a no because that's the patient's not reporting that. We are feeling it. So is it presumptive? I mean, probable or possible? Positive. Probable or positive? It's positive because we can't feel gas moving in there. So if we feel a kick, it's the baby because nothing really will move around in there and kick us. The uterus has gotten enlarged. Presumptive, probable, or positive? Probable, okay? We can tell the uterus is enlarged, so it's an examiner finding, but a lot of things can cause uterine enlargement, so it's probably pregnancy because that's the most likely thing, but we don't know until we do other testing. And one more. Fatigue, exhaustion. Is that always a sign of pregnancy? Absolutely not. It's presumptive. And here's your clue. Not all nursing students are pregnant, but they are all fatigued. So I think that's probably the end here. We'll do the next arrow. And well, I got one more slide. It says, let's see. So how did you do? The summary is presumptive, patient notices or suspects. Probable, the provider sees, feels, or suspects. Positive, fetus is seen, heard, actually felt. So get familiar with those because you probably are going to have to know those at some point in your life. All right, guys, let's see how I do with getting this one loaded. Bye.